The Biden administration says Americans will be able to request free rapid COVID-19 tests starting next week. The announcement comes as tens of millions of people are struggling to get a hold of those tests. The daily new case average is now more than 800,000. Hospitalizations have already topped last winter's peak. Infections among children are also increasing exponentially. Manuel Bojorquez has more from Miami.
Tonight, as Omicron continues to surge nationwide, pediatric hospitalizations are soaring, more than 360%. A mix of children admitted for COVID and some who test positive after being admitted. Only 35% of children aged 5 to 17 are fully vaccinated. Now New Orleans is among the first districts in the nation to require proof of COVID vaccination for eligible students as young as 5 years old by the beginning of February, though parents can opt their children out. In the last week, more than 1,600 students have tested positive for COVID.
Based on the number that we're seeing right now, and also hearing that the majority of our individuals who are being hospitalized right now is the category of children, that's really concerning, alarming to me.
Meanwhile, the Supreme Court's decision to strike down the Biden administration's vaccinate or test mandate for large companies has now left millions with a patchwork of state and local rules. At least one company, GE, has already suspended its policy requiring employees be vaccinated or tested. But demand for at-home rapid tests has never been higher.
So this has been 24/7 now for weeks.
Yes, Ron Gutman, co-CEO of the company that makes the on-go tests, showed us the round-the-clock operation at one of its manufacturing facilities.
People have seen the consequences of not knowing if they are infected or not. And I think that people are more aware of the value of being tested regularly. We want to keep schools open. We want people to go back to work, and we want them to do it safely.
And the CDC has just updated its masking guidance, stopping short of recommending a specific mask, but saying that Americans should wear the most protective mask they can that fits well and should wear it consistently. In the meantime, the White House announced that U.S. households will be able to order up to 4 rapid tests online at the website covidtests.gov starting Wednesday. Jamie?
Lots of people looking for those. Manuel Bojorquez, thank you. For more, let's bring in Dr. Campbell. He's a critical care physician and a professor at the University of California at San Francisco. Doctor, thank you so much for being with us tonight. I know here in Los Angeles, you're in California. I have friends going to 4 or 5 different drugstores trying to find those rapid tests right now. What role could these rapid home tests play in the fight against this pandemic once they're readily available?
Jamie, thank you for having me this evening. The government and local government and state and federal government, for that matter, has really been behind the 8 ball when it comes to these at-home tests. It should have been distributed widely, it should be widely available. But the reality is that many regular people have been struggling to get tests. You go down to one pharmacy, second or third one, it should have been readily available. So we probably should have rolled out mass testing earlier. In many ways, the government really was pushing vaccinations, which I think we still should. And you mentioned how low the vaccination rate in adults, it's 62%, and kids, it's only 35%. If we get that number up, it will do better, and we won't have as many pediatric hospitalizations as we have. We must protect our kids who are in school as best as we can.
I know so many people talking about that, as you just said. Just over 35% of children between the ages of 5 to 17 are fully vaccinated. I think there is some disconnect in terms of the messaging. So as a doctor, what would you have to say to parents who are choosing not to vaccinate their children at this point?
In my opinion, it is dangerous not to vaccinate your child. This is an incredibly communicable disease. Think about what's going on now. We have now we've been diagnosing 800,000 cases. There's been roughly 850,000 people who have died from the vaccine, and we're diagnosing between 600 and 700, 800,000 cases a day. So the country is really wildly on fire. There's 150,000 people in the hospital, and includes adults and children. So my advice to the parents are, get your child vaccinated as soon as you can. They're safe. There's been no complications associated with it. Please do that for yourself, for your kids, and make sure they're safe when they go to school.
Yeah, I know some friends out here whose children were vaccinated and they ended up picking up Omicron, and the kids were pretty good after a day or two. I mean, it really does make a difference. When we're talking about these vaccinations, researchers in Scotland say that unvaccinated women with COVID are more likely to lose fetuses and infants in the womb or shortly after birth. What are the risks of COVID-19 during pregnancy?
We have known for quite some time that it's much safer to vaccinate a pregnant woman than to let her go to term without being vaccinated. And what has happened is, because of the risk of blood clots and other complications that go along with COVID, the fetuses or the potential child in the future are at really big risk for dying. I mean, that study showed that it was several times more common for the fetuses to die in utero, which is terribly tragic. And this is something that's totally avoidable. If a woman takes the vaccine, she is vaccinated, and so is her child when they're born. What better gift can you give to your child than to vaccinate your child against a deadly disease that they won't be able to? Right now, they can't take the vaccine until they're 5. Now, they're working on earlier kids who are younger, but it is important to make sure we protect the unborn children, get the mother vaccinated so that we don't result in a tragedy and a tragic loss of life with the kid dying.
Yeah, and it really psychologically has such an impact on the mother when she loses a child as well. I do want to ask about people who contracted COVID-19 after being vaccinated. Does that infection effectively serve as a booster shot, if you will, for them, or do they still need another dose?
That answer is no. They've done studies looking at the responses you get from actually getting an infection and when you take the vaccine, and it's orders of magnitude different. So that even if you get infected, if you are already vaccinated, you do need to get that booster. I think that we need to think about this as 3 is the new 2. Being fully vaccinated means that you have 3 shots, 2 of the preliminary ones and the booster, so 3 shots total. So 3 is the new 2. So to be fully vaccinated, you must have those 3 shots as soon as you possibly can to be fully vaccinated.
I think that's an important point for people. I'm also wondering, could an infection with Omicron provide immunity against any potential new variants that we start seeing?
I think it's too early to say that. There is some degree of immunity that occurs when you have the infection, and that's just with anything when you get any kind of viral infection. But it is nowhere near the immunity that you get from your immune system being turned on from the vaccine. That's the purpose of the vaccine, is that get your immune system ready, get it revved up so that you get exposed to it, the virus goes away, it says goodbye, right? That's really what we're trying to do, is to make sure that you're ready to take on the infection when it comes.
You know, we heard so much about herd immunity early in this pandemic. Now, given the community spread of COVID-19 with Omicron, Delta, all these other variants, will we soon reach the 70% mark we've heard we need to end the pandemic? Or are we watching that percentage change?
I think that it's going to change. It's not going to be that 70%. It's going to have to be higher because, especially with Omicron being so infectious, it's probably more infectious than the measles. Instead of one person being infected when you had maybe 7 or 8 being infected when you had Delta. Now, Omicron is orders of magnitude higher than that. It's way more infectious. So you're going to need to get up to 90% or more. But that's just my speculation for us to get the quote unquote herd immunity. Herd immunity was that amount where there was so much immunity where people don't get infected. But it's going to be much higher. But at 62% of people being vaccinated with 2, with 30% being vaccinated with 3, only 35% of children being vaccinated, we are in a bad space right now. We need to really focus, make sure we protect each other, wear that high quality mask you can, whenever you can, make sure you're well ventilated with places you go to, and make sure you're assessing your risk, because whenever you travel now, you're at risk. I mean, there were 20 million people who traveled in 2 weeks. A lot of those folks may have gotten infections because of where they went. So it's important for us to make sure that you get that vaccine into arms as soon as possible, and that the availability of these tests that we're talking about is going to really help us guide whether or not you're infectious or not in order for you to get back to work.
All very important points. Dr. Andre Campbell, we thank you so much for being with us.
Thank you so much.